Hello, I'd like to share some information with you today in regards to the differences between panic and anger attacks. This information was written by Cheryl Ankrum and reviewed by Amy Morin. This is coming from verywellmind.com. It is not unusual for people who may suffer from panic disorders, agoraphobia, any other type of anxiety disorder to experience frustration because of their diagnosis. You may blame yourself or others for your diagnosis, your symptoms, your conditions, further escalating the senses of anger and resentment. Sometimes the frustration can develop into anger towards yourself, anger towards your situation, anger towards others. The following describes the symptoms of anger attacks and panic attacks with differences that are explained. So, symptoms of anger attacks, according to researchers, anger attacks are characterized by occurrences of at least four of the following symptoms, whether that's hot, cold flashes, chest pains, tightening, discomfort, tingling in or itchy skin, excessive sweating, dizziness or lightheadedness, feeling like attacking others, fear of losing control, intense fear of anxiety, shortness of breath, physically attacking others, possibly shaking, trembling, throwing or destroying objects. The symptoms of panic attack can be characterized by four or more of the following symptoms. This has come from the DSM-5. Kind of feelings of unreality, depersonalization, if you will, chills or hot flashes, chest pain, discomfort, feeling like you are choking or choking up, excessive sweating, dizziness, unsteadiness, lightheadedness, fear of losing control, heart palpitations, heart pounding, nausea, numbness, trembling or shaking sensations of shortness of breath. And so when we're attempting to understand the differences between an anger attack and a panic attack, it's easy to see that there may be some similarities between the symptoms of anger and panic attacks. But to point out that both produce many of the similar sudden intense physical or emotional sensations. They also do note, though, some differences, the researchers. So researchers propose that anger attacks typically occur in situations in which an individual feels emotionally trapped rather than a result, of fear and anxiety that is often associated with panic attacks. In addition, there are some criteria that are unique to anger attacks, which can be irritable feelings within the past 6 months, inappropriate anger directed towards others, one or more angry or angered attacks expressed in the past month, and angry overreaction to small irritations. So many things can trigger anger attacks, including financial difficulties, work, social pressures, stress, lack of sleep, family or relationship troubles, even frustration over a panic disorder, agoraphobia, or any other type of anxiety disorder. So anger attacks can be a symptom of numerous health conditions as well, not limited to bipolar disorder, grief, at times depression, attention deficit hyperactivity disorder, or ADHD, alcohol misuse. So with depression, individuals that are diagnosed with depression express anger attacks as a result of calming annoyances. For bipolar disorder, when a person's in a manic state, Anger or extreme anger over mild irritants can manifest. People or individuals that have been diagnosed with ADHD often express a greater emotional intensity. Alcohol misuse, misusing alcohol makes it or can make it more difficult to control emotions at times. Also, with grief, it's common for individuals to express anger or anger attacks after the loss of a loved one. So, panic attacks can be unexpected, out of the blue, or cued by thinking about or being exposed to something that a person's fearful of. For instance, individuals that may have a fear of flying, animals, public speakings, may experience some panic attacks. So, when coping though with anger attacks, if you feel like you're experiencing anger attacks and it might be interfering with relationships, work, personal life, speak to a doctor or a mental health care provider, excuse me. Together with your mental health provider, your doctor, nurse practitioner, you can develop an anger management plan, which may include identifying triggers, behaviors, reactions, and learning, practicing relaxation techniques. Some of those things can be meditation, progressive muscle relaxation, visualization, deep breathing, again, and yoga. So, your doctor may also prescribe your nurse practitioner medication to assist in reducing symptoms. Good self-care routines are important. That may include eating well, exercising if you're able to, managing your sleeping habits, building a solid support network. So, I think the takeaway is by following through with the treatment and embracing healthy lifestyle techniques, choices, a person can kind of be able to receive the support that may be necessary to work through those anger attacks. So I hope this information was of assistance for you today, and I hope you do enjoy the remainder of your day.